Hey everybody, Chris Bailey with Physical Therapy and Balance Centers in Erie. I'm here with our patient Pat, who's thankfully allowed us to show what's going on with her. So what we found, she's been coming here for a little while and her vertigo is changing, but I'm going to show on the video up there where her eye is moving in an upward direction. And she's seen this before, but what that means, and we'll show it more in a second here when we do a maneuver to correct this, is in her inner ear she has this little center called a vestibular center, or it's an area that measures our balance and where all of that comes from. What happens is you have little crystals that come loose out of this part here, and they can go into any one of these three canals. And what the goggles do, based on how her eye moves, is tells us which canal the debris is in, the crystals. And then knowing which canal it's in, it helps us to do a certain maneuver to get the crystals out of that canal back where they belong, so she'll no longer have the vertigo or the dizziness. So what we're going to check out is I'm going to put the goggles back on Pat. I'm going to have her come up on the table, and when we already checked this before to do the evaluation, we saw that her eyes beat in an upward way with two different tests. So that means she has actually some crystals loose in the back canal on both sides, which is pretty unusual, but of course that's the way she kind of rolls. So what we want to do today is we're going to look to see to the right hand side, it was the worst side, where she has the vertigo, and we'll see her eyes beat in a certain direction. And we'll also check it out on the left hand side, but we're going to do a little maneuver to the left hand side first is what we're going to do. So I'm going to have her sit up. We have this special table that reclines so it doesn't put her neck in a real awkward position. And then what we'll do is go through what's called an Epley maneuver to help get these crystals back where they belong in this little chamber. Okay? So I'm going to have you go ahead and slip those goggles back on over your head that way. Everything's in order here. So the purpose of these goggles is if people have vertigo for a while, they get what's called accommodation, so their eyes no longer move in the light. So we can see her eyes, and she can't see any light right now. And what that does is it kind of fools the brain into allowing the eyes to move so that we more accurately know what's going on. So what I'm going to do is go ahead and bring your feet up onto this table here. Good. And scoot your hip right over to your left hand side here, Pat. Just a little bit more perfect, just like that there. Okay. Now what we'll start to see is, what we want to see is that eye beat in an upward motion once we get her to lean back here in a second. And then we're going to slip the goggles off, Pat. Once you probably will get a little bit dizzy, okay? And it'll just be for a few seconds like it was before. And then what we'll do is we'll slip those goggles off and we'll go right into that maneuver to try and correct it, okay? So I'm going to turn your head to the left, and I'm going to have you come back towards me on the count of 3. 1, 2, 3. We'll probably see her eyes start to go up and down just like that there, which shows us it's in the back canal on the left hand side. Dizzy at first, Pat, but now calming down.
But it did calm pretty quickly.
Okay, so let's sneak these off. And I'm going to have you keep your head just in that same position right there. So don't really move it up, just let it rest in my hands there, okay? I'm just okay, calm down a little bit with that.
Yes.
Okay, keep it right there for a second. And I'm going to just bring this table back up to flat. Okay, now what I'm going to have you do is go ahead and bring your left knee up just into a upward position like that. Yep, just like this here. You can bring this foot down onto the table.
Okay.
Bring this arm up across your chest like this here. I'm going to have you turn towards me and you'll end up looking down towards the floor, okay? To roll into your right shoulder. 1, 2, 3. Good.
Oh boy.
So they usually get a little bit of dizziness here, and that's a good sign that things are moving like we want them to. And it usually eases pretty quickly, a little bit better there.
It did ease quickly.
Sometimes we just do a few little pats or use a little vibratory oscillator to get some of those crystals moving. I'm going to bring your head back up into this position. Okay, go ahead and bring your feet up this way here. I'm going to have you just sit right up on the count of 3. 1, 2, 3.
Okay, a little bit of dizziness there too.
Okay, go ahead and scoot up this way here. So what we'll do then is we'll let Pat kind of relax here, and we can do what's called a recheck. So what we would want to do is to do this same maneuver over on her left hand side, and you most likely will not see the eyes moving up and down, which means that the crystals have been cleared from that area. Thanks, Pat.